We are back with Dr. Jolene Cannady talking about veterans' health, what you need to know, and how you can, of course, help. So how can veterans stay proactive about their health during and after their service?
So the first thing that I recommend they do is to find a primary care provider, whether that be in the VA or the civilian sector. And that way they can ensure that they are staying on top of all their necessary screenings and getting their vaccines and making sure that they're keeping an eye on their mental health. So staying active, and if they notice anything concerning, ensure that they reach out to someone for help. And the other thing I always recommend is that veterans let a civilian provider, if they have a primary care provider in the civilian sector, know that they have served, because that helps us know what we need to look for in case of exposures.
And how can family members support veterans who may be reluctant to seek help, especially for mental health issues?
Okay, so one thing I hear a lot from veterans is that they want to be given some space and they want to be given some time to talk about their situation, because it can be very difficult for them coming back into the civilian sector. And still, mental health still has a major stigma around it, especially for those in the military. Because when we think of military, we think of strong heroes. And so they are looked at as tough and strong, and they fear that if they go into talking to their family about mental health, that they're going to be judged. So I feel like as a support system, let them know that you can go with them to any appointments and be a partner beside them, and then help them feel comfortable with mental health and with seeking help, and create a safe space for them.
And what are two misconceptions about veterans' health that you'd like to set straight?
So the first one is all veterans have PTSD. That is a major myth. Not all veterans have PTSD, and it really depends on genetic makeup and how the brain works for each veteran. So that's a big one. Some veterans, they transition very well back to civilian life and they do not have any post-traumatic stress syndrome. And then some do come back and struggle with mental health disorders. And then the second one is that only combat veterans face health challenges. And that's not very true as well, because there are many veterans who never saw combat, who were just in training, and they could have had a traumatic brain injury while they were in training. They could have chronic pain, so from jumping out of planes, or different injuries while they're training. And because training can be very vigorous, and it takes both physical and mental health to work through this. And then while training, they can get a lot of different injuries. And then there's also different sort of incidents within training that can cause some PTSD.
Yeah, how important is early intervention with both the physical and mental health challenges veterans face?
So early intervention, I feel like, is the main key. The more knowledge we have of this population, the better we can care for them in the civilian sector. If we create an environment where veterans feel heard, then we can encourage early intervention and help them before a problem becomes too big.
Okay, and what should the community know about creating a supportive and healthy environment for veterans in their everyday lives?
The first thing I would say is just to give them space. On return to civilian life, they may not want to interact much because they're coming from that brotherhood or that sisterhood, just that family, and they're coming back into an environment where they have to learn a different role. So they may be constantly on, and they may be a little more hypervigilant than before. It doesn't mean that we can't help them transition. It just means that we have to let them do that on their own terms. And then always ask them what you can do for them, and let them know you're there for them on their terms.
Yeah, absolutely. Any final thoughts on what we should know about veterans' health?
I think the big thing that I hear from veterans a lot is just monitor what you are asking them. Don't ask them if they hurt anyone, or if they saw people pass away, or what wartime was like, because some of them are not ready to discuss that, and that can be very challenging for them, especially if they're struggling with mental health issues and they're struggling with maybe doing things that they necessarily didn't want to do. And then we need to allow veterans to discuss things on their terms, and sometimes we may never hear their stories, and we have to be okay with that, and we have to let them process their stories on their own time.
Absolutely. Well, thank you so much for being here. And we know that mental health is such an important conversation. So happy we were able to have this discussion.
Thank you. I appreciate it.
Absolutely. Well, remember, if you missed our entire conversation, you can find it on WFMYnews2.com. Tim.